That's a little better. Good morning. Before we dive into today's topic, I want to introduce myself. I'm Dr. Malia Jensen. I'm a family practice physician located in Iowa. And every weekend, Saturdays at 9 a.m. Central, Sundays at 10 a.m. Central, I spend time with you guys answering live questions and hopefully giving you an answer. With that being said, I like to start out with a topic. And so before we dive in to today's topic, you've likely heard me talk about medical buffoonery that we've all been fed for years. And my mission, you guys, is to make sure that you never get bamboozled again by a diagnosis or a medication. So to keep that mission going, front and center, I have made official No Longer Bamboozled by the Buffoonery t-shirts, and you can find that at my Fourth Wall store. So click on the links, they'll be in the description. Wear it at your next appointment. See what your provider says or does. So I want to thank you guys all for being here today. It lets me know that you are investing time in yourself, in your health, and we're going to walk through some things today. Good morning, Ohio. So today, we are going to discuss what I think is an age-old topic, yet it still seems to come up. In fact, this past week, I did a reel on this topic, and it went viral. I actually thought we were done talking about this topic because people were losing interest. That is far from the case, obviously. People still want to talk about it. What is that? It's heart attacks. People want to have information on heart attacks. I don't blame you. It's supposedly the number one cause of death. So why wouldn't we want to know more about it? Now, where we deviate, I should say, between myself and other providers is the cause of those heart attacks. And I think we got you guys caught in the middle of what to think. I got Dr. Jensen on this side saying it's not LDL, and I got my cardiologist who's treating my LDL with statins. Is there a time and a place that we need to take statins? Are we just treating a number? Or is there a benefit to a statin and why? I got a whole bunch of comments going back and forth. And that's what I like. I like to be able to ask you guys questions. If your doctor says your LDL is 140, I think you should go on a statin. Do you ask why? Do you ask what the mechanism is before you just go take your medication? Those are really hard questions because we've been infiltrated with a lot of information over the last 50 years, okay? And it is incredibly difficult to unlearn those things and say, gosh, is Dr. Jensen correct? Or is my cardiologist who says LDL is the cause of heart attacks? It's hard. Good morning, Angel. Good morning, Lara. Thank you. Yes, this is a beautiful day that the Lord has made. I totally agree. So is there an argument for taking a statin? What do statins do? For one thing, statins are a type of medication called HMG-CoA reductase inhibitors. So it's inhibiting HMG-CoA reductase. When we inhibit that particular pathway, that is called the mevalonate pathway. Mevalonate pathway. When we block that with an inhibitor, we are blocking a normal biologic pathway. Because along that pathway, we also get vitamin D. We also get CoQ10. We do get cholesterol. We get vitamin K. We get vitamin D. We get a lot of things out of that pathway. So when we block it, what is the topic today? Heart attacks. So when we block that pathway, we are not only just blocking the formation of cholesterol, production of cholesterol, we're blocking a whole bunch of other things. Now, statins, their main function is to lower LDL, lower cholesterol. Cholesterol is carried by lipoproteins. LDL is low density lipoprotein. HDL is high density lipoprotein, okay? If we block the mevalonate pathway with a statin, an HMG-CoA reductase inhibitor, we're not getting hardly any production of cholesterol, okay? So the particle numbers are going to go down because there's nothing to be carrying as cargo. Is that a good thing? Some would say, yeah, man, that's a great thing because LDL, those bad guys are the what's causing my heart attack. And then somebody else might say, oh no, we need LDL for our brain. We need it for everything. It's our part of our immune system. It's a carrier of cargo that goes to every cell in our body, and we need it. Okay? You can see where there's going to be division. And what I want you guys to do is just think through things, first of all. If a statin lowers your cholesterol by blocking a normal pathway, we have consequences. We talked about those. But what if there's something good about taking a statin? Those good things are, it helps fight inflammation. Statins are anti-inflammatory, okay? We can check inflammation by getting a high sensitive CRP, C-reactive protein. We can also check an interleukin 6, IL-6, that's an inflammatory marker. We can get a SED rate, an ESR. Those are inflammatory markers that we can look at to check on our inflammation. Chronic diseases cause inflammation in our body, okay? Not just heart disease. What if you got lupus or psoriasis or acne or anything? Those are inflammatory processes. Any chronic, what about your gut? Your gut. That's an inflammatory process. If you got bloating and gas and all, that is an inflammatory process. Everything of chronic disease is from some sort of inflammation. So as far as the heart is concerned, we can take a statin that will lower inflammation in the heart, and we check a high sensitive CRP and see if it's working. All right? What else do statins do? Statins, by their nature, are antithrombotic, meaning they're going to decrease the clots in your body. They're going to either increase the dissolution of them, meaning breaking them down, dissolving them, or help that they don't get produced in the first place. So that's a tall order to give a statin because we have a lot of things going on in our body. And do we take a statin to lower clot formation and lower inflammation, knowing full well that it blocks normal pathways in our body? Okay? That is the question. And I want you guys to think about why we would take an anti-inflammatory of any kind before we would look at the cause of what's causing the inflammation. Why would we also take an antithrombotic before looking at the cause of what is allowing for clot formation? Do we have a blood clot disorder? Has your doctor checked for factor V or prothrombin mutation? I believe what is happening is we are reducing heart attacks to LDL. And if we treat this number, we're going to give everybody, go blue, we're going to treat everybody with a statin. when we treat everybody with a statin, in the back of our head, we are assuming that we know that LDL is the cause of heart attacks. That is called the cholesterol hypothesis of heart attacks. But there's another hypothesis circulating out there for years that has gotten very little attention, and that is the thrombotic cause or hypothesis of heart attacks. So basically, we have clots that are causing the heart attacks. And we can get clots for a number of reasons. I mentioned one reason was, hey, did you check for a blood clot disorder? My question is, what boggles my mind, do cardiologists and other doctors sincerely know that blood clots are a cause of heart attacks? You would think that they would know, because the very nature of what statins do is antithrombotic and anti-inflammatory, but they also lower LDL. Why is it, are they only concentrating on LDL when the inflammation and the clot is what could be the cause of your heart attack? Because if you're just looking at plugged up arteries, people don't even get symptoms until they're 70% or more blocked. So you're not even going to get a symptom until your arteries are 70% or more blocked. And hopefully, if it's been going on for long periods of time, you have developed collateral blood flow. So you have this chronic buildup of plaque, and we can talk about the formation of the plaque, but you have this buildup of plaque, say, and when your heart arteries or your heart muscle is sensing that there might be diminished blood flow, over time, collaterals, tiny little blood vessels, kind of branch off and they feed that muscle. So the main artery is, if it did go bad, at least you have all this collateral flow feeding the muscle, and you may never know that you had blocked arteries in the first place, okay? The stability of that plaque is in question, because if you look at the plaque, there is going to be a hard component to that plaque, and there could be a soft component to that plaque. The fresher it is, or more acute it is, it's likely a softer plaque that over time will harden. And that is how we measure calcification, okay? We will measure a calcium score, and that will measure calcified plaque, but it does not measure soft plaque. So your doctor might tell you this. They might scare you and say, oh my gosh, your calcium score is 100. We got to put you on blah, 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 statin. Then it goes to 150 on the statin. And it's almost like they flip their switch and say, oh, good. That's a really good sign that you're getting more plaque. And they're going to tell you why it's a good sign is because they're hoping that what got more calcified was the soft plaque you had. So they're going to say, oh, that statin is really working. It's stabilizing your plaque. It's stabilizing the soft and making it hard. Okay, let's say it does. What caused the soft plaque in the first place? This is where the thrombotic hypothesis comes into play. Picture an artery. An artery has protection to it. It has layers of protection. If they didn't, our arteries would be destroyed much, much earlier than they are, okay? But when we supply an injury to the inner aspect or the inner lining, I had some notes here and I just wanted to make sure I didn't miss anything in my notes. When we have an injury to the inner aspect of the lining of the artery, that is where it all happens. Now, the lipid hypothesis or cholesterol hypothesis will tell you that the actual injury is an LDL particle. I believe we are getting past that buffoonery and we are no longer bamboozled by that buffoonery of LDL causing an injury to the lining of your artery. But what could be causing the injury? It could be an infection. Infections, even that come from our gut, right? Special bacteria in our gut that release lipopolysaccharides, those can injure the lining of our arteries. Sugar, you guys know this is a big one. I've talked about it over and over. And maybe, just maybe, fructose is more of an injurious agent than glucose. So sugar. What about insulin? I mean, if sugar's up, insulin is inflammatory. We're causing more inflammation in an area that's already inflamed by the injury itself, okay? What about, hold on, you guys. What about smoking? Yep. Drinking, alcohol, yes. Heavy metals, yes. Nanoplastics, yes. All of those things, plus more that I didn't even mention, can cause an injury to the inner aspect of the artery. Causes a scab formation. Then we get blood clot formation. All of the little warriors come to patch up the area. Just like if you were to cut your hand and it starts to bleed, then it coagulates. You don't want to just bleed to death from a little scratch, right? So we have a mechanism to clot that. And then a scab forms, doesn't it? A scab. And then that scab will protect the injury until the injury heals from the inside out. The injury will heal from the inside out, okay? And then the scab falls off, and underneath, you got new skin again. Is that possible to occur in the arteries? Yes. But why doesn't it? Because we never stopped what was causing the injury. If I continue to cut my hand in the exact same place over and over and over again, will it heal? No, it's not going to heal. Same with the inner aspect lining of our arteries. We need to stop the injury. LDL is not even on that list, is it? I didn't mention LDL as a cause of injury to the inner aspect of the artery lining. Because it's not. And if it was the cause of the injury, if we lowered all the LDLs, heart attacks would not occur. It's got to be something that increases clots. It's got to be cuts over and over and over again that is stimulating a clot formation. And then that clot, even if it continues to get injured, is going to build more and build more. And hopefully that innermost clot calcifies. Because they're right, we don't want an unstable clot that can break off and go to the heart or the brain and cause a stroke. But did you guys know that that clot, that plaque, actually needs a blood source? It needs nutrients. But you would never be able to feed, inside the artery, got blood and nutrients, right? We can't feed the cells that are much deeper with nutrients and oxygen because the blood cells and the nutrients can't get through all of the plaquing. So guess what feeds the inner aspect of this clot? It's tiny little arteries on the very outside, the lining of the artery. You know, when you look at an artery, you look down the middle and see how much plaquing is in there, right? But what about the outer, the shell of the artery? Large arteries have another blood source. It's called the vasovasorum. The vasovasorum. And the vasovasorum starts to branch and get inside the artery so it can feed the cells so they don't die. However, the vasovasorum, when it branches out into these tiny little blood vessels to feed the inner aspect of the artery lining, guess what? They break. They are not superheroes by any means. When they break, red blood cells infiltrate. Did you hear what I just said? The inner contents of what the vasovasorum was carrying are red blood cells, right? It's blood. Red blood cells are very high, hold a lot of cholesterol. So if the red blood cells are infiltrating the innermost aspect of that plaque, could that be what they're finding when they dissect that plaque out? So say you died and you want some sort of an autopsy, and they take they said, oh, you had a heart attack. They looked at your arteries and they had plaquing in there. So they spliced that little artery out, and then they dissected the plaque, and they want to look at all of the particles that make up that plaque. Red blood cells, white blood cells, platelets, cholesterol, all of these things. And they're going to be able to see the layers. And it's kind of like the rings on a tree. As the tree gets older, more and more rings. So as the plaque gets older, more and more layers of scabs. Linda, you're not blocked. I'm seeing you right now and answering and seeing you're on here. So I don't think you're blocked. I don't know who would have blocked you. You're just not one of our blue wrenchers anymore. So RM is our blue wrencher here for today. Okay? So I believe that there could be two components to this heart attack thing. I don't want to put all the chips into it's just a clot, although it is just a clot. I'm going to say that there is some cholesterol part to this story. The red blood cells purely dumping cholesterol into the area is part of the story. But what about these small, dense LDLs that everybody's talking about? Is it possible that the cause of heart attacks is a combination of these thrombogenic hypothesis and the, say, cholesterol lipid hypothesis? I think yes. Because it would be impossible to disagree that small, dense LDLs are not a cause of heart attacks. We would be missing a huge component if we said that, no, the lipid hypothesis is out, it's the thrombogenic hypothesis, it's in. I believe we would miss the component of small, dense LDLs. A small, dense LDL is basically a larger LDL that dumped out its cargo over time. If that small dense LDL does not circle back to the liver before it gets oxidized, it now becomes a problem. That small dense LDL gets oxidized, it gets damaged. When it gets damaged, it gets very sticky. He's not a good guy. He gets eaten up like Pac-Man by macrophages. Macrophages see it as, uh-oh, we got some foreign thing in us. When that macrophage comes to chomp on, Pac-Man up, the small dense LDLs, it becomes something called a foam cell. We have found in the plaque these foam cells. So that must mean small dense LDLs are in that plaque. But again, if there is no injury, infection, sugar, insulin, smoking, alcohol, heavy metals, nanoplastics, then is the small dense LDL going to cause problems? Good question, right? But we know that there is an injury. How? Well, the very fact that you have a small dense LDL available, you have an injury. And that injury is sugar and insulin. In order to produce small dense LDLs, you are going to have high blood sugar and high insulin. You might not have diabetes. So what boggles my mind is that we know as physicians that diabetes is the number one cause of coronary artery disease. Coronary artery disease, atherosclerosis. We absolutely know that. Yet, doctors treat the LDL number and don't treat the diabetes. They will send you back to your primary care, look at your labs and say, oh, your blood sugar's a little high, but your A1C is less than 6.0. It's 5.7. So you don't have diabetes. Really? You just told me my blood sugar was high. Yeah, but that's just kind of it's not very realistic. It's just, we watched the A1C. Yeah, but doesn't blood sugar continue to rise until we do get diabetes? Yes. The answer is yes. Well, then why aren't we lowering our blood sugar? That's a very good question. So the cardiologist is going to treat your LDL number, and he thinks that if I get the LDL down to 27, that's low, that you are just magically not going to have any small dense LDLs around. That's wrong. A statin or any medicine isn't going to say, I just want those little guys and the LP little A's to go away, and we're going to leave the rest to, well, that's not really what's causing the problem. There's no medicine alive that's going to do that. So you still have the small dense LDLs. Why? Because you have high blood sugar and high insulin that they never checked. And you drink alcohol and you smoke cigarettes and you breathe in nanoplastics and heavy metals from the soil. And you get infections because your gut health sucks. And so you develop bacteria that release lipopolysaccharides, which go into the blood and cause more inflammation. Probably the greatest chance of causing inflammation is the gut. Yet the cardiologist is treating your numbers. I did my job. I'm going to get that LDL down to 27, and you're not going to have a heart attack until you have a heart attack. And then they'll say, I wonder what happened. You're just the oddball. You're the one with low LDL, and you got a heart attack. Because they were only treating the LDL. They didn't treat the inflammation. They didn't treat the clot formation. Oh, but they gave you the statin, which is an antithrombotic, and it's an anti-inflammatory. But it's not good enough because you continued with the infection, the sugar, the insulin, the smoking, the alcohol, the heavy metals, the nanoplastics, and everything else that was causing the injury. And number one, they told you that it's diabetes is the number one cause, but yet your primary care doctor poo-pooed you. You don't have diabetes. Your A1C is fine. Well, there's a lot of things that can falsify an A1C, okay? A lot of things can look like a normal A1C when it is not a normal A1C. This is why I have problems when a client hires me to look over their labs and they tell me that their doctor just simply put them on an LDL lowering medication. And then they say, well, let's start dieting and exercising. Well, what kind of diet is that? Well, you should follow a Mediterranean diet. Well, can you tell me about that? Just look it up. And then they'll tell you, and you should probably exercise. Well, what should I do? Well, I can send you to physical therapy and they can talk about exercise for you. But, you really should go for some long walks. That is the information that you're being given by your cardiologist, your primary care, and whoever else is taking care of you. And that, you guys, is why you are all here listening to me talk about the origin of heart attacks, because not only do you not want to die of a heart attack, you also don't want to get cancer, and you don't want to get lupus, and you don't want to have dementia, and it's all related, you guys. 80 to 90% of all the diseases that we get is inflammatory. You would think that a statin would just treat everything, because everything is inflammatory. So let's just put everybody on a statin to lower the inflammation. And an aspirin. But you can't take ibuprofen, an NSAID, a non-steroidal anti-inflammatory, because that actually increases your risk of having a heart attack. Unless, of course, you choose Aleve, which is less of a chance that you'll have a heart attack from an NSAID. The conversation is all about what medication can I put you on that will decrease your chances of having a heart attack and a stroke. And we're going to choose something that lowers LDL, because that is obviously the cause of our problem. It is not. Okay? I can never stop talking about this, because I don't think we know the exact mechanism. But I do know this. We need to stop the inflammation now before this worsens. I had people this week tell me that statins will stabilize the plaque. And that's a good thing, that there are so many benefits to a statin. And it's almost like the person was so engulfed, so much cognitive dissonance, that they actually didn't think about all of the side effects. And if they did, here's what they did. There's so many benefits to a statin that it outweighs all of the negatives of blocking the mevalonic pathway. So if we don't have vitamin D, you guys will just take vitamin D. If we don't have CoQ10, you'll just take CoQ10. If you don't have vitamin K, you'll just take vitamin K. And if you don't have cholesterol, you'll just take whatever you need, like your sex hormones. You'll take testosterone and estrogen and progesterone. You'll just take them, because the benefits of living 5 extra days by taking a statin, studies show that you can extend your life 5 extra days if you take the statin for 5 years. And in the meantime, statins actually increase your risk of diabetes. They increase your risk of getting diabetes. Dr. Jensen, didn't you say that diabetes was the number one cause of coronary artery disease? Yes, I did say that. So you're going to take a medicine that lowers your LDL, that is anti-thrombotic and anti-inflammatory, yet you will increase the risk of the number one risk factor that's causing coronary artery disease, which is diabetes. It causes glucose intolerance. It causes insulin resistance. And eventually, it causes diabetes. Insulin and sugar are the number one injurious, the injuring of your artery. And no one is talking about your diabetes. Okay? I don't understand it. And if they do talk about your diabetes, guess what they talk about? Here's your metformin, here's your Jardiance, here's your GLP. All of these have been shown to decrease the inflammation and keep your blood sugars down. Okay, I'll hand it to you. They do. But what if you could reverse all the inflammation and the clot risks and the injuries to the inner lining of your arteries simply by changing your diet, getting out in the sun, exercising on a daily basis? You could do all of that. You can reverse all of this. Do you want to? That's the question. Do you want to improve your life without having to take a medication? I think it's possible. I really do. What are you guys' thoughts on everything I just got done talking about? Where do you need clarification? I'm live on Instagram and YouTube. I don't have a whole lot of talkers on this on Instagram, but I see a lot of thumbs up and I see a lot of 100% going around. You know, it must be clicking for you guys because you're sticking around listening, okay? Is fish oil a good supplement to take respect to heart health? The fish oil concept is that fish oil is omega-3s. Omega-3 inherently are anti-inflammatory. We want a ratio of omega-3 to omega-6 1-to-1. But we have in our current modern diet much more omega-6 than omega-3. So Ohio is asking, do we simply take more omega-3 so let's say you got 20 of omega-6 and 5 of omega-3 in your blood system, okay? I'm just giving round numbers so I can get, and so we're going to take enough omega-3 to get this up to 15. Is that our goal, to get a 1-to-1 ratio? Or do we bring the omega-6 down, okay? And we're at these normal levels down here. Well, there's no reason we need 20 omega-6s. Really, we don't need 20 omega-3s. We just need enough that they balance each other out that way down here. Because omega-3s and omega-6s are polyunsaturated fatty acids. All polyunsaturated fatty acids, PUFAs, oxidize. They can all oxidize. Oxidation, we need some oxidation in our body. We need some reactive oxygen species. We cannot live without them. There's a normal balance of oxidation and reduction of that oxidation. So the question is, should we take fish oil, I'm guessing in a capsule, to protect our heart by lowering the inflammation. But what if I told you that the fish oil that comes in the capsule is already oxidized? So now you're putting oxidized oil into your body. It is of no help with respect to decreasing your heart attack risk if you're consuming oxidized omega-3. Can you get good sources of omega-3? Maybe you could actually eat the fish. You could eat sardines. You could eat salmon. You want to get good sources. You see, it's not really the fish that produce the omega-3. It's what they eat. They eat in the sea the things that make omega-3. Does that make sense? If a cow is grass-fed, they make more omega-3s. There is so much in our environment that decreases omega-3s or oxidizes it before it even gets a chance to do anything. Now, I remember when Lovesa came on the market. Lovesa was prescription omega-3. Was it cleaner? I think it was. It was probably less oxidized. But simply taking a fish oil omega-3 capsule, I don't think is in our best interest. I think it's already been oxidized before we even get it in our mouth. So I think we should do pure sources like the grass-fed meat, grass-fed or pasture-raised eggs, the fish, the salmon, high omega-3 animals, okay? And that might increase our omega-3s. But we're still probably not going to have enough omega-3s if we're causing or have in our body all of the inflammation. If we continue to put the inflammation into our body via the infections and the sugars and the insulin, the smoking, the alcohol, the nanoplastics, the heavy metals, etc., then there's really, omega-3 is not going to keep up. Your statin couldn't even keep up. So shouldn't we be thinking about decreasing the inflammation? So we got to subtract the inflammation that we're putting in our body. We can go low carb, which is low sugar, which will lower the insulin level. We could stop smoking. We could stop drinking alcohol. We could exercise by lifting weights and doing high intensity interval training. We could stop smelling the air. That's not going to work. But we can avoid exposure like diesel fumes or being a city slicker with all of the exhaust. We could also move away from the farms that are spraying chemicals into the air. And the closer you are to Nebraska, Iowa, all of these monocropping states, the higher your risk of cancers and all inflammatory disorders. You can, somebody sent me the other day, Mystery Eraser. Mystery Eraser is just basically microplastics put together that you use on your wall and shoots plastics into the environment that you're using them. So can you get rid of mystery erasers? Absolutely. I can avoid that plastic. Can you stop drinking out of plastic water bottles? Absolutely. Can you switch to stainless steel? Yeah. These are just the easiest things you can do. What about all the other inflammation in your house? You can get rid of the light bulbs that are LED. You can get rid of all the smelly things in your house, like the laundry detergents and the little plug-in things. You can get rid of all that stuff. There's a lot you can be doing. You could stop cooking with oils. They're already oxidized. You can use butter and tallow and lard. You can use all those things. You can change all of that stuff. But yet our mind gets really scared really fast because you hear LDL and you think heart attack. And so I must take a medicine to lower my LDL so I won't have a heart attack. Yet you continue to do the things that raise your risk of diabetes, which is the number one cause. And you take the statin, which increases your risk of diabetes. So you're going to really have diabetes and have no no cognitive function as you get older. Your joints are going to be basically whittled away. And so you call that normal aging. I don't call any of that normal aging. I call that normal progression of the chronic inflammation that we've caused in our body over years and years and years. Can you reverse it? Yes, I think so. I am a big believer that God made no mistakes with making our body, and that we can reverse it by stopping putting in what man has made to poison us. That's right. Man has made the things that are poisoning us. How else do you think it got here? There has to be some sort of a creator of the chemicals, a creator of the fake food, a creator of the nanoplastics, a creator of ruining the soil that's full of heavy metals and runoff from the chemicals that we put on our monocrops. We could talk about the people who started making cigarettes. We can talk about the people who started making polyunsaturated industrial oils during the war. And then it just so happens that we can cook our food in Crisco, which is cottonseed oil. We can do all of these things, you guys, but yet we don't know what we can do because not everybody's on social media listening. They're listening to their doctors. Those are not the people we're going to reach, believe it or not. We're not going to reach them. They don't want to take their blinders off. They don't even know that they have blinders on. They have such trust in their doctors that they will listen to them even though the doctors don't know the full story. They've never been taught. They've only been taught guidelines, rules. If doctor treats LDL of 130 with medicine A, doctor will get a pat on the back. And a lot of pats on the back will continue by behavior of writing the medicine for the number. You have depression, here's your antidepressant. You have blood pressure problem, here's your antihypertension. You have a cholesterol problem, here's your anti-cholesterol medicine. You have blood clot disorders, here's your antithrombotic. You have cognitive decline, here's your anti-cognitive decline medicine. Are we ever going to peel back the onion and get to what is really causing everything? The person who has a heart attack, they just so happen to have the heart attack before they got lupus or acne or cognitive decline. That was their disease of choice. Because you know that not everybody smokes gets heart disease or cancer. That wasn't their disease of choice. They got something else from their injury to the lining of the arteries. And no doctor, they'll say, you really should stop smoking, but here's your statin. How does a statin help with the smoking part? What is the mechanism there? There isn't one. There isn't one. So they're so focused on an LDL number and to get rid of your heart disease when that isn't even on the top 10 list, believe it or not. Right? Not even on the list. CeraVe. I love this stuff. It could be bad for me. I don't even know. I've never even looked into it. It's got petrolatum in it and some other things. It helps with the blood flow to your lips, makes them red, so it causes vasodilatation. I don't know, you guys. We have a lot of answers that need to be answered, a lot of questions that need to be answered. And I don't even know where to begin. I don't even know if what I'm telling you right now is right. Okay? I don't know. in my heart, I feel like I've already been on the lipid cholesterol hypothesis of coronary artery disease. And I've watched my patients still, despite having low LDL, have heart attacks. And I'm going to be perfectly honest, and this bothers me so much. I had hundreds of people on statins, hundreds of patients. Oh, imagine, I have been in practice for 27 years, 27 plus years. So you can imagine how many people in 23, 22 years that I have put on statins. And do you know how many of those statin users got diabetes? It's almost too many to count, you guys. So I put them on a statin, and then I started treating them for their diabetes with metformin and Jardiance and a GLP and all of the things. I've even been guilty of putting them on insulin. You guys, a type 2 diabetic has more insulin than they could ever use their entire lifetime. And I just gave them more because I could not control their diabetes. Doctors don't know everything, you guys. They don't know even half of it. They are following guidelines. They're following things that they've been told to follow. They're doing a recipe, and you guys are the pawns. But are you going to blame the doctor? Can you solely just blame the doctor for what you are doing? I don't think so. You can't blame it all on me. Because the statin didn't cause your diabetes. It caused glucose intolerance. It increased insulin resistance. But you can't get insulin resistance without having elevated blood sugar. So you guys had to have eaten the blood sugar or eaten the sugar to raise the blood sugar. So you really can't blame it on the doctor, although you could go, hey, doctor, you're held at higher responsibility. You should know these things. But you see, there's so much protections out there for the doctor, by the board, by the guidelines, by the 3-letter agencies, that we really don't get in trouble unless it's really, really blatantly bad. And most doctors are not blatantly bad. They just don't know. And so if you want to go to fourth wall, I did make a t-shirt of ignorosis, the definition of ignorosis. Osis means a condition of. So ignorosis is a condition of ignorance. And there's a definition, and you can buy a t-shirt, and then you can wear that to your doctor's appointment. So yeah, check out the descriptions. Go to fourth wall Iron Lady Doc, and you can look at all of the apparel. It would help the channel out. And it might get a laugh out of people who are reading your t-shirt. I don't know what's wrong, you guys. And I have a feeling that like Evan says, things are going to get worse, but we can't put our head in the sand and expect that we're just going to follow all of the things that the doctor says because they're just guidelines. I mean, can you just believe that nothing has changed in the past 50 years when it comes to fixing coronary artery disease? Really, how about cancer? You would think after this many years, cancer would have been gone. But it's not. In fact, it's gotten worse. Yet we have all of these medications and they can't even kill it. And they'll say, oh gosh, we ran out of medicines that we can possibly use. Your cancer cells are they're replicating out of nowhere. We just can't stop the replication. Well, what caused the cancer in the first place? Did we ever go back to ground zero? No. But we can fear you into looking for cancer. We can actually test to look for all your cancers. To get you scared before you even get cancer, we can check your DNA. And do you know how many DNAs have a positive for cancer? Oh my gosh. Yes. So what feeds those? infection, sugar, insulin, smoking, alcohol, heavy metals, nanoplastics, inflammation. Cancer is inflammatory. Alzheimer's is inflammatory. Parkinson's is inflammatory. Heart disease is inflammatory. Acne is inflammatory. Psoriasis is inflammatory. Lupus, inflammatory. Rheumatoid arthritis, inflammatory. But I got your medicine. I got your medicine, you guys. The doctor has your medicine. Evan says there is a Newsmax report coming out saying changes to cholesterol standards are being discussed. They are. Evan, they have been. It went from LDL is not the bad guy. It's LP little a. It's ApoB. We're just going to change the goalposts a little bit. So that's the cholesterol standard. They finally admitted, probably in 2016, that what you eat as cholesterol isn't going to cause coronary artery disease. So they got away from the fact that you could just eat the cholesterol. It would go down your esophagus, into your stomach, dump into your small intestine, and magically clog your arteries of your heart. I mean, that hypothesis rode a long time, that your mouth to heart is basically just some sort of plumbing system. It's just a pipe. I mean, imagine how many years we were bamboozled by that buffoonery. I mean, you talk about a condition of ignorosis. I had it. I didn't maybe suspect that we eat this and it automatically plugs up my artery, but I bought into everything else. I bought into the LDL. I bought in hook, line, sinker. Here's your statin, people. I was putting people on statins and I would tell them, here, you know what I said? Here, you guys are going to get a kick out of this. I said, you have high cholesterol. You're at risk for coronary artery disease. I don't want to take a statin, doctor. Okay. In the chart. But don't blame me if you fall and have a heart attack out in the parking lot. That's how much I believed that LDL was the cause of your heart attack. And we got to lower it at all costs. I didn't even remotely know about inflammation. I knew about joint aches and pains being inflamed, but I had no idea about injuries to the lining of the artery. I had no idea about the thrombotic hypothesis of coronary artery disease. I didn't even know how plaques were formed, except for the fact that LDL must have been the problem. But then over and over, I was telling myself it can't be the problem because my patients are still having heart attacks and their LDL is like 30 because that's what they told us to do, high dose statins. But I got muscle aches, doctor. Don't worry about it. The risk, the benefits outweigh the risks and the side effects. Yeah, but doctor, I really can't stand it anymore. I mean, it's bad. I go, okay. I mean, it's up to you. You can stop it. That's your choice. You got freedom of choice. But if you have a heart attack, could it be from you going off your statins? Well, I'm only going to take it 1 day a week then. Okay. So for 24 hours, you'll lower your cholesterol. And then the other 6 days, your cholesterol will be running free. Your liver is just, it's exploding cholesterol production. Yeah, but when I take it too many times a week, I really get muscle aches and pains, and I feel like I can't even think straight. I got brain fog. That's not a thing. You know, that's in there, but I rarely see that. Yeah, but all my friends who take statins, they got the exact same symptoms as I do. I don't know. You know how you can get deceived by reading about side effects, and then all of a sudden you magically get them? I believe that's probably what's happening to you. You're just thinking you got the symptoms because you read about it. Oh yeah, I didn't do that just to degrade the patient. I actually believed what I was saying. That's how cognitive dissonance I had. I was bamboozled by the buffoonery. Imagine the day Dr. J woke up and it jumped out of the matrix. I'm going to tell you, that day was the day I called up one of my friends and I said, today's the day I'm stopping my statin. If something happens to me, here's where the will is. Please take care of the dogs. Do this with the house. Do this with this. Do this. All of it. I thought I was going to die. And my friends, I mean, they're like family to me, said, you're going to be just fine. There's no reason that you're going to have to be telling us about your will and doing this. And this has been, has it been 4 years now? I was on high dose statins, or just say statins, because I thought the more the better, right? So I dosed myself. That's how bamboozled I was. So not only did I treat you guys, I treated the doctor. That's how much I believed in it. My cholesterol was high. My dad had coronary artery disease. I better take the statin. 29 years. I mean, it's imagined that I even have some cognitive functioning that I can talk to you about coronary artery disease right now. Calcium score was 0 and I still took the statin. Calcium score is still 0 off the statin. Does that tell you if LDL is the cause? Doubtful. But could small, dense LDLs be the cause of your coronary artery disease? A cause? No. A recruit? Yes. A member of the plaque? Absolutely. You can only really get small, dense LDLs from sugar, carbohydrates. Carbohydrates, those non-essential foods, the ones you do not need ever in order to survive the rest of your life. You do not have any essential carbohydrate needs. There are none. There are 0 goose egg essential carbohydrates. We do not need them. You have essential fatty acids. You will die without a number of essential fatty acids. Fat. You will die without essential amino acids. I don't know when. I don't know how long you're going to succumb to all of the side effects first. I don't know. But absolutely, you could live the rest of your life without a carbohydrate. Now, is there a subset of people? I've talked about this before. They're carnivore. They're eating high fat, moderate amounts of protein, 0 carbs, or very, very, very low. They're exercising. Yet their LDLs are sky high. That's enough to want to trigger a big, giant scare. Fear. You see an LDL of 300 when it should be less than 100, you're going, I'm going to have a heart attack. I started this carnivore diet and I went from 140 to 300. I'm going to die. Are you? The normal carnivore coach or doctor will say, let it go. You're likely a lean mass hyperresponder. Your triglycerides are low. Your HDL is high. Your insulin is low. You're good. You're following a carnivore diet. Your insulin is between 3 and 5. Your triglycerides are less than 70 and your HDL is above 70 or 70 or greater. Metabolically, on paper, from what we know, you are A-okay. You're like perfection. You're never going to have a heart attack. Your inflammation is so low. I even got a high sensitive CRP on you. And it's like 1.5. It's 1.5. Let's just get a little bit, dangerous here. So your CRP is 1.5. Really, they say anything less than 3 is good. And then some docs will say, really, it's got to be less than 2. And then there's really strict ones that say it's got to be less than 1. The more inflammation, the more chronic diseases. Heart disease, cancer, Parkinson's, MS, all of them. Joint disease, all of them. So when is a carnivore at risk of a heart attack? They're at risk when they have a very high LDL, low triglycerides, high HDL, and a low insulin, and you never looked. The doctor or the person doing the carnivore never looked because 90% of the time, that is a perfect panel until it's not. What is happening is that person's liver, see, when we make LDLs or VLDLs in the liver, it goes out into this bloodstream and dumps off its cargo, and we get LDL. And LDL circulates and dumps off its cargo, and then HDLs come. This is pretty trivial, like simplistic pathway, okay? HDLs come, pick up the rest of the LDL, deliver it back to the liver. Now, two things could be occurring. We don't need any more LDL. So that tells the liver not to make any more VLDL. So the LDL will just stay in the bloodstream, elevated at 300. And usually that is fine until it's not. What if that LDL dumped off all of its cargo? HDL was supposed to bring and take it back. The liver needs some of that LDL, just not a lot. So the liver receptors are kind of the doors keeper. They'll say, hey, we don't really need any more LDL right now. Okay? Fine. We'll just keep it around out here in the bloodstream and we'll use it. We'll use it. We're going to just use it. But what if you're under stress? Because you're not eating carbohydrates, right? Carnivore, Mr. Carnivore, you're not eating them, but you're kind of under stress. You're always kind of that anxious person. You're go, go, go. You're a bit of a road rager. You got a lot of cortisol. Cortisol, chronic cortisol. Good cortisol is great when you need it, and then it's supposed to go down. But if it's chronically elevated, it's going to chronically elevate your blood sugar. So you actually have more blood sugar than the average person, even though your insulin is low. So that blood sugar is going to oxidize those LDLs, those small ones. And now you are a person who's following carnivore, right? And you have low trigs, high HDL, low insulin, low blood sugar, maybe even right on the edge, 100. Yet your small, dense LDLs are sky high. Are you at risk of a heart attack? Yes, because small, dense LDLs get oxidized. What is the problem with that carnivore that you would think they got a perfect panel until you look with a NMR, nuclear magnetic resonance imaging? If you looked at that NMR, you would see the small dense LDLs. Doctor would say, oh boy, you need a statin. Or let's figure out why those small dense LDLs are up. That particular person with the liver that has the low amount of receptors cannot tolerate that much saturated fat going into your body. You are a person who cannot tolerate that much saturated fat. So the answer is lower saturated fat. Doctor, but I need the good fats. Okay, I agree. Then what do? You increase monounsaturated fatty acids. You're going to get rid of some of the saturated fat and increase in its place monounsaturated fats. The monounsaturated fats, like lard, so instead of tallow or butter, use lard. It's monounsaturated. Could you use olive oil if it was real, which it's not? I don't know if you could ever find real olive oil. Could you eat avocados? Yes, that's monounsaturated fat. If it was real, I don't even know if the avocados are real anymore. I mean, they're all being fake, genetically modified. We just don't know. But I guess I can trust the lard. But my point is, you're going to increase monounsaturated fat. You're going to lower some saturated, and then you're going to recheck in about 3 months. And you're going to see that the small, dense LDLs came down. You guys, if you are coaching, you're a carnivore coach, or you're a doctor listening right now and you are into carnivore, and you get one of these LDLs that are in the 300s, please, please, please just check an NMR. Get an advanced lipid test and just make sure. You can easily fix it. You don't have to tell the person to go off carnivore. You don't have to tell them to go off carnivore. You just kind of make a few adjustments. That's it. But don't miss this person. Okay? Let's see if I'm missing anything. Evan says the doctor also said that primary care doctors want to check them at 30 now. You mean LDL's down to 30? Melanie, that's a good point. But ApoB is still going to be high because of the remnants. So even though you lowered LDL or you lowered small dense LDLs, there's going to be some ApoB that are remnants. Remember, ApoB is in LDLs, VLDLs, triglycerides. It's in all of that. Okay? So what you're measuring, ApoB, you're kind of measuring the whole gamut, and then they're giving you a number. It's just kicking the can into another, it's another way that we're going to continue on cholesterol-lowering agents. Well, your ApoB is still high, even though your LDL came down. And then we're going to put another bucket. We're going to really try to catch all of the LP little a's. And mind you, they're going to tell you that it's genetic. Your LP little a is genetic and you can't bring it down. But it just so happens that we have doctors out there, researchers, who can make an LP little a lowering medication. Makes you want to go, So you're telling me that I can't naturally lower it, but you can help me lower it by giving me a medication? I don't know, you guys. Is that buffoonery? Good morning, Dr. Christie. Let's see. If you guys have a question over on YouTube, please put a Q in front of it. There are so many comments. I'm not sure. Dead Wednesday asks, how do you increase gut health and avoid inflammation in the gut to avoid malnutrition? What caused the inflammation? Is it fluoridated water? Is it high intake of carbohydrates? Is it high blood glucose, high blood fructose, high insulin, nanoplastics, tobacco, alcohol, heavy metals? That's how you increase gut health, is to avoid the inflammation that you are putting into it. So your gut is experiencing what somebody else might experience with a heart attack, clogged arteries. You got bad gut because of the food, fake food usually, that you're putting in your body. Fake food increases inflammation. Okay? You want an anti-inflammatory diet. That means no carbs, really. Carbs are inflammatory. They're full of sugar. Sugar's inflammatory. Insulin's inflammatory. So you don't just take something to get rid of the inflammation. You remove the inflammation. Half Hawk, Half Man says, why is consuming animal fat so healthy? Animal fat, for the most part, is a combination of saturated, monounsaturated, and polyunsaturated fatty acid. Yes, it is, all of them. In fact, we need essential fatty acids, right? Those are the polyunsaturated fatty acids that we talked about earlier, omega-3 and omega-6. If you did not have omega-6, you would likely die. If you didn't have omega-3, you would likely die. Animals, in general, especially ones that are grass-fed, have all of them in the perfect amount. But if we grain-fed an animal, now we're going to have more omega-6, too much omega-6, and then we're going to consume all of those omega-6s. Now, the caveat is an animal like a cow or deer, bison, buffalo, sheep, lamb, they're ruminary animals. They have multi-chambered stomachs, and they're going to have less effect on us eating them than if we eat a monogastric animal like a chicken. If we eat a chicken with only one chambered stomach, like an adult, a human, we when consuming that chicken who was grain fed, we are going to, by eating that chicken, now consume a bunch of omega-6s that the chicken couldn't take care of. That is why you probably want to eat an organic pasture-raised chicken for sure. But a grain-fed cow, you can be more reassured that you're going to be taking in less omega-6 than if you ate the cow eating the grains, okay? So a grass-fed cow, deer, bison, buffalo, sheep, lamb, is going to have a perfect combination of 3 to 6. And that's probably what we should strive for. And that is why maybe consuming animal fats is healthier than consuming an oil or a plant oil. The big 8 that we need to avoid, and it's up to you, you don't have to, but that's sunflower, safflower, soy, cottonseed, canola, corn. There's 6. Then rapeseed rice bran and oh geez, I'm having on the 8th. Anyway, those are industrialized seed oils that we are consuming in everything that is processed. Not only are we cooking with the oils, we heat them up, we oxidize them, we're basically oxidizing outside of our body and then putting it in our body to oxidize even further, which is killing all of our cells, you guys. We're aging our cells. They can't keep up. The cells can't keep up. The outer membranes of the cells can't keep up. The mitochondria, which are inside the cells, can't keep up. We are slowly killing our cells. Now, if you say, doctor, wow, this is a lot of information. And you know what? You overwhelm me and I'm just going to die anyway. So I'm going to enjoy. That, my friends, is your choice. If you want to age gracefully, I would suggest not going that route. However, if you don't care about your aging and your body aging and your cognitive decline and your cancer and your diabetes, if you don't care about that and you want to just risk it, go for it. Nobody's telling you can't. But if you're concerned and you've been listening to me and you say, gosh, I just don't want to go through that. And if there's a chance I could slow this whole process down, I'd love to be able to do that. Now we got some alternatives. Okay, Half Hawk says omega-3 fatty acids are essential. Yes, correct. That significantly improve cardiovascular health by lowering triglycerides. Yes, they do lower triglycerides, but if you're eating stuff that raises triglycerides, it's going to be like this, back and forth, like a roller coaster, up then down, then up then down, okay? Reducing blood pressure. How do omega-3s reduce blood pressure? Omega-3s are anti-inflammatory, right? Blood pressure is an inflammatory process, usually caused by, you guessed it, blood sugar and high insulin. So do you take an omega-3, over-the-counter omega-3, or do you eat the omega-3s? You should be eating them. I mean, that's the way we should be getting them in whole foods. And yes, they will help lower triglycerides, unless, of course, you're eating so much sugar that you're raising the triglycerides beyond what the omega-3 can do. And then reducing your blood pressure. But if you're consuming so much sugar that raises blood sugar, that raises insulin, that's the number one cause of high blood pressure. So are you going to expect your omega-3s to keep up with the crap that you put in your body? No. Do omega-3s slow artery plaque buildup? Possibly, if they can keep up with all of the injuries that you're causing. So, Half Hawk, what you mentioned here is not wrong. It's just that you're going to put a lot of chips into an omega-3 when you should be taking away the parts so the omega-3 can actually do its job and keep up. 1910, I appreciate that. If you like this content, please like and subscribe. Share it with your friends, your family. Get it out there. I'm not proposing that I know the exact answers. I'm just trying to get you guys to think that there could be something other than what they've told us with the buffoonery. I believe we've been bamboozled by many, many things. And today we're talking about one, and it's the cholesterol hypothesis of coronary artery disease. Okay? Julia says she's not playing the game. She hasn't been to a doctor in years, except for listening to me, right? But I'm not your doctor, and you're not my patient. In fact, none of you are. This is not medical advice. It's for information purposes only, and I really appreciate you guys are being here. It shows to me that you want to take an active role in your healthcare. That is a very good question. Oculo asks, do you tell your patients once you start them on a statin that they have a high risk of getting diabetes? If you want them, then it's all on them. The answer to your question is no. But listen up. I do not treat patients in the office anymore. I am completely online doing consultations with those who want to have a consultation with me. I provide no medical advice. I give information only. I will review your labs, your diet, your medications, your diagnoses. I will do all of that. I will talk to you about your medications. I will talk to you about your options. I will tell you why there's certain things are being used and not used. I get you to think, write down stuff, take it back to your doctor, and hopefully have a good conversation. I am basically your doctor coach. I do not provide medical advice. So the answer to your question is no. I don't tell them when I put them on a statin because I don't put them on statins. Okay? I'm trying to get you guys off of your medications, not on them. If a person is on a statin, I do tell them that you increase your risk of getting diabetes, or if you have diabetes, making it worse. I do tell them that, Oculo. And I make it a very strong suggestion as well, okay? Diabetes is real, but honestly, the people had diabetes or pre-diabetes long before their doctor put them on a statin, okay? And yeah, if I tell them that, then it is all on them. And what you're talking about, Oculo, is actually informed consent. If I put you on any medicine, I, as a doctor, have the responsibility to tell you all of the pros and cons. But what if, and I'm not getting myself off the hook, what if I was actually never told about all of this? Should me as doctor, held at higher standards, have gone and looked into the cons of the side effects of statins? Realistically, yes. Who talks to the patients more than anyone else? The pharmacist. Do the pharmacists know that statins increase the risk of diabetes? No. Do they tell you about muscle aches? Yes. If you get a muscle ache with this medication, please talk to your doctor. At least they talk to about one of the side effects. The doctor never mentions them. Ask yourself, those who are listening right now, you're on a statin. Did your doctor tell you that you have increased risk of getting diabetes, increased risk of cognitive decline in the form of Alzheimer's or some sort of dementia? Did they tell you about the muscle aches and pains? Did they tell you about lowering your immune system? Did they tell you to take CoQ10? Did they tell you to take vitamin D? Did they tell you that your testosterone and your estrogen and your progesterone levels will likely go down? If they did, that is called you have enough information in order to make a good decision based on you. But if you are never given any of that, and you are only told that your LDL is elevated, and if you don't lower your LDL, you have high risk of getting a stroke or a heart attack. And if you do tell them that you had one of those side effects, they'll tell you, heart attack or muscle ache? Heart attack or muscle ache? And you go, okay, doctor, you're right. I'll just stick it out. I can't really move anymore and I can't play basketball like I used to, but you're right. I don't want to have a heart attack. I'm going to stay home. I'm going to watch TV. I'm going to eat bonbons and I'm going to get diabetes. RM says, what do you recommend for insomnia nutrition-wise? Stop carbohydrates, stop blood sugar from going up, exercise in the morning, do not exercise at night, avoid drinking anything caffeinated before, stop before noon, do not eat your last meal within 2 to 3 hours of going to bed. Those are some basics. Coffee drinker says, I have been diagnosed with PCOD. Do you mean PCOS? My blood sugar is a little high. A little high. Normal blood sugar is between 70 and 80 fasting. So I don't know what a little high is. And we've been prescribed metformin. It gives me nausea. Is it possible, Coffee, that you could actually lower your blood sugar level without taking metformin? The answer is yes. That would require you to stop your blood sugar, which the blood sugar coming back down to normal will lower your insulin. You see, it's your insulin that's high. Does metformin deal with insulin? No. Metformin actually, this is what metformin does, okay? Metformin opens up the doors on the cells. Why are the doors shut on the cell in the first place? Good question. The doors on the cells are shut because the cells don't want any more blood sugar. They are resistant. They do not want any more food. They're full. Yet the doctor is going to give you, coffee drinker, something to open the doors. You're gonna force your cells to open the doors to take in more food when they're full. And that's going to cause the cells eventually to simply explode. And they will release more cytokines and more inflammatory condition. And so now we've actually worsened your PCOS, which I'm thinking that's what you meant. So PCOS is actually acting like a blocker in your ovaries to convert testosterone to estrogen. So you get a buildup of testosterone because all estrogens come from testosterone, but not a female with PCOS. Her testosterone won't convert. It won't aromatize because insulin blocks that aromatization. So you get a buildup of testosterone. You get bigger because you never stopped the blood sugar that raised the insulin. So you'll get more obese, you'll get infertile, you'll grow male pattern effects like hair, balding, deepening of your voice, anything that testosterone causes. But most of all, you can't have babies because you're infertile. So instead of taking metformin, you could have just stopped the food that's raising the blood sugar that raises the insulin that blocks the aromatization from testosterone to estrogen, which you need in order for your ovaries to function and have babies and not have hair growing a beard. The real term says just eat steak every day and you'll be fine. Well, I could go into that too. If you just eat steak every day, which is muscle meat, that's a great choice. But if you continue to eat, I will be with you, stop that. If you just continue to eat muscle meat and don't eat any organs and don't eat any other forms of things that increase collagen, forms of collagen. So basically, if you're just eating muscle meat and not organ meats and not any forms of collagen, you are increasing your risk of getting too high of methionine. If you have too high of methionine, which is in muscle meat, then you are going to exhaust the amount of glycine in your body. And glycine, you guys, is very, very important amino acid. And if glycine is being used up to neutralize all of the methionine you're eating, that might be a bad step because you need glycine to make glutathione. And glutathione is, hey, one of the master antioxidants in your body. In fact, we have these antioxidants. There's like 3 main antioxidants, and they're fighting off 4 or 5 reactive oxygen species, the main 4 or 5. If we can't make glutathione because we don't have enough glycine, because we ate too much methionine, we have a problem. We need glycine. So what you do, real term, is increase your glycine. If you want to continue eating muscle meat, just increase products with glycine in it. Eat some bone broth. Eat the skin and the bones, nibble on those. Get the collagen. That's rich in glycine. Now you got enough glycine because our body makes it. It's basically it's a non-essential amino acid, but it's conditionally essential, meaning our body can't make enough because it's being used up because you're stressed and you got infections all over and you got inflammation, and glycine is kind of a cleanup crew. So then you go to carnivore, you get all of this methionine and use up your glycine, so you're basically just about the same as if you weren't just eating steak. It's a bad situation to be in, okay? So I wasn't trying to, I just don't want you saying just eat steak and everything is good. There are things that are caveats to just eating steak, and nobody mentions those to you. And so, if you don't have this glycine, then you're not going to have glutathione, and you're going to wonder, why are you getting infections all the time? Or why are you stressed all the time? Because you don't have enough glycine to take care of all of the other things that glycine does in the body. It's working on your steak all day long. What is the difference between lard and tallow? What animal it comes from? So tallow is from beef and lard is from pigs. The lard in most stores is hydrogenated. Hopefully it's not. Maybe ask your butcher and see if you can't get just some, real lard. Everything is going to be a problem, you guys. What kind of copper bracelet are you wearing? I'm actually not wearing copper. I'm wearing stainless steel, and it's got magnets in it. And then this is my killed in action. Joshua Weinrosser, he wasn't killed in action. He actually committed suicide in 2018. He left his wife and child behind. So Joshua Weinrosser, he was a senior airman in the Air Force, and he was born in 1995, and he committed suicide in 2018. So I wear that for him. Do I know him? No. So 22 suicides our military goes through every single day, and it's probably more, but we call it 22 a day, and it's suicide awareness. So that's what I wear. Copper, you can wear a copper bracelet. You can drink out of copper cups. Copper is very important. Copper helps to neutralize our iron. So copper is a big thing. But thank you for noticing. You're a detail-oriented person. I appreciate that in people. Uncle Charlie has been eating carnivore diet and been lifting weights for the last month. Noticed gaining weight is muscle. Awesome, Uncle Charlie. You should have told him what your whole story was, how many pounds you've lost by going on the carnivore diet. V-Ben. I really want a GLP, but my BMI is in a healthy range. Is it possible to get on to just lose a couple pounds? Well, sure. Just go online, go to row.com, and you can buy your own. It's really too bad that you have to resort to taking a medication to lose a couple of pounds. But yeah, you can go to Hims or Hers or Row, or yeah, you can just go. I bet you have emails in your from GLP. They can sell you a little bit of compounded Ozempic and you'll be just fine. Yeah, Lifter Dave, I would agree. I think it's a little more. I think it's 5 to 7 days. So if you take a statin for 5 years, you'll get 5 to 7 days of life expectancy. That is in a person who has not had a vascular attack, so has not had cardiovascular disease or stroke. So a person who is what we would consider, I think we would consider healthy, that person, by taking statins for 5 years, might get 5 to 7 days extra life. And you're going to live 5 years with all of the side effects, if you have them. My Lifter Dave says his doc took statins for years, now has 3 bypasses. So it wasn't the LDL, it was what they're putting. They put fake food. I mean, I have seen doctors eat. I've seen what they do to themselves. They are the total opposite of me. I am a rare breed doctor, I will tell you that. Lifter Dave says insulin is a double-edged sword. I agree. We need it or we die. We have too much and we die. On one hand, you need to regulate your blood sugar. Agree. And on the other, too much is highly inflammatory, causing multiple problems. Agree. I can't agree with you anymore, Lifter Dave. I can only add to it. Ooh. Yeah, Lifter Dave, the P53. Yep. You know, there is, so P53, now correct me if I'm wrong, I can just tell you what I know, but I might not know. It is found on cellular membranes. And there are things, I believe, that make the P53 gene more susceptible to things like cancer, okay? Long COVID, other inflammatory things. And if we did certain things that decrease inflammation, P53 gene is in, now, Lifter Dave, if I'm totally off base, please correct me like right now, okay? Okay? So I, don't get off base here too far. But there are studies now on astaxanthin. Astaxanthin. I believe that's how you say it. Astaxanthin at a certain dosage can go get into a cell and change the logistics of how cancer is developing or replicating itself. And there have been studies, and you can look them up in the PubMed, what astaxanthin is doing for inflammatory conditions, especially with cancer. I do not know the dosing. I know that there is one patent, I don't know, I'm having trouble with that word. It's got a patent on it. And I believe it's called Valaxin, V-A-L, AXA, A-X-A, Valaxa, something like that, you guys. There have been lots of studies on astaxanthin as an anti-inflammatory. And correct me if I'm wrong, but I think astaxanthin is high in algae, high in plants. I think even high in colored vegetables, high in those things. Thank you, astaxanthin. Thank you. I have, Lifter Dave says, I read where intense weight training increases P53. I'm not aware of that. I have not studied that, okay? I just know that there is a correlation between P53 and studies ongoing with astaxanthin, okay? And yes, it's in krill. So it's in things I believe it's in those animals that eat that algae, right? So it's not the krill that makes astaxanthin. It's what they're eating, which is the algae. The krill are eating what's in the food, what they're eating. But again, I want to, before we go deep into this, let's take astaxanthin, is what is causing the inflammation, and did we remove that? If we removed all the inflammation and you want to take astaxanthin after you've done your due diligence and reading and all of that, then hey, go for it. And let's keep up on all of the studies. But, I don't think the big pharma companies are going to want you knowing that you can take astaxanthin and kill off your cancers in like 10 seconds or less when you can take their pharma chemo, blah, blah, blah medicine. I think there's going to be a lot of eye-opening going on, okay? I don't know exactly, but does a GLP like Ozempic cause cancer? Can it cause cancer? Yeah, it can cause cancer. It can cause thyroid cancer. All GLPs, if you have any history of medullary thyroid cancer in your family, then you are at high risk. Does Ozempic itself lead to cancer? Well, you guys who are taking the GLPs in high doses, you'll be the first to know. You are the guinea pigs. There are no studies at the doses, ongoing studies. They're ongoing. There's no long-term studies that say the doses that we are given of Wegovy and Zepbound, Mounjaro, you guys are the studies. They're doing it as we speak. That, and they're killing beagles. So they'll give their GLPs to all the dogs, kill them off, tell them, they got cancer. We'll hide all that information, and we'll just keep giving it to the people because the people are buying it. Supply and demand. You get big, you get diabetes, here's your medication. You don't want to remove the things that cause you to get big and get diabetes. No. What you want to do is just take the easy way out. Am I a practicing doctor? I do consultations online. If you would like to sign up for a consultation, you can email me at ironladydoc, ironlady, Lady, doc, DOC, at AOL.com. Ironladydoc at AOL.com. I do online consultations. I talk to you about your labs, your diet, exercise, your diagnoses, your medications. We put everything into an organized plan so you can talk to your doctor about everything that you have learned in 1 hour or less, or 1 hour or more. Okay. Yes, lovely Mimi. It does give flamingos their color. They have astaxanthin in them, right? Yes. Yes, it comes from anything red, from red spirulina. It's in red chlorella. It's in algae. Yes, you guys are getting it. There are even some doctors who use astaxanthin in their skincare products because it's an anti-inflammatory. See how many things that we have not even touched? Does Big Pharma own as astaxanthin? They might in the future. They'll get some patent like the Valaxin, VAL. What is that? VAL. It's it is the only patented astaxanthin out there, I believe. It's the only one with a patent. Constantly asked, would magnesium deficiency cause mental health issues? Yeah, that and headaches. Okay. What should one do about fluoride poisoning? My daughter, well, if you got fluoride poisoning, you need to get it unhooked from your cell receptors, right? And so you need to consume things that would maybe remove fluoride, so the other halides might displace fluoride. But remember, when you displace fluoride from the receptor, you're going to get a bunch in your bloodstream. You can, chloride, fluoride, bromide, iodine, those are all halides. And all of the halides, besides iodine, fluoride is basically a toxin. I mean, it is only a toxin. And I don't know if you could take enough iodine to displace the fluoride or bromide or even chloride from the receptors. I'm not sure. So I wish I knew the answer, and I don't. I'm sorry. Jag says, I tried to keep away from big pharma. That's probably a good plan, but they're going to come get you. They're going to give you the disease and they're going to treat it. But they're going to make it that you volunteered to get the disease, which you did. You volunteered. You smelled diesel fumes. You lived in the city. You chose to live in the city. You chose to live on the farmland. You chose to eat sugar. You chose to drink alcohol and smoke and do e-cigarettes. You chose to drink out of plastic bottles and use magic erasers. You choose all of these things. You provided the supply and they provide the demand. So you can avoid them all you want. They're still going to have enough supply and make a demand. There's still going to be a lot of demand, and they're not going to lose business. Okay? Because you guys, you're the fringe minority listening to me and wanting to change things. You're fringe. You're like on the outskirts. Okay? Do I practice fasting? I do. So I'm fasting right now. I'm hungry. But that is normal. I haven't eaten since 6 o'clock last night. So it's 11 now, or close to 11 a.m. So I went 6 and 11 hours is 17 hours, right? So I probably won't eat until around noon. So there's your 18 hours. Now that's not every day. A lot of times I might have my first meal around 10 a.m. because I'm hungry. I eat when I'm hungry. It's just that I can't eat at 10 a.m. because I'm talking to you guys right now. Or whatever time I decide to eat. Yesterday, I was not hungry. I did not eat until it was afternoon. And then the next day, it might be 9 a.m. because I get done with exercise and I'm going, oh my gosh, I would love some eggs and ground beef right now. And so I eat when I'm hungry and I don't eat when I'm not hungry. So that is fasting, basically. Okay? All right. You guys have been so good today listening to me. Very, very good questions. See you, Lifter Dave has got to leave. So, okay, good. All right, thanks for being here. I appreciate it. You guys, did I miss any questions? Did I miss any questions? Eddie, thanks for being here. I appreciate you as well. Yes, 1910. Thank you to the veterans. I agree. Okay. Looks like we answered all of the questions. Yep, the real term. Thank you for answering that. Okay. The Gunther is here he's listening from Europe and says that he trusts, or she trusts the farmers in Europe. They're real non-genetic food. Okay. Looks like I answered most of the questions. I'm not seeing any. Ohio, you're very welcome. Ohio says, we appreciate your informed educational advice. It's educational information. I don't necessarily think it's advice. I actually want you guys to make a decision for you. I don't want to make the decision for you. I do want to provide you with information so you can make a decision. We cannot make decisions if we do not have enough information. We can make decisions, but it might not be a good decision. Not that you would make a good decision if you had all of the information. What I'm saying is that we would make a better decision with the enough information provided to us, okay? B-Man says, can bentonite clay and shilajit help remove heavy metals from the body? Yes, I've heard that. Do I know for a fact that if you sit in a Epsom salt and bentonite clay bath, that you're not, one, going to feel amazing when you get done? Could it be a detox? Yes. For heavy metals? Yes. Shilajit, I believe, is made from volcano ash. Shilajit is full of minerals. Shilajit is full of the earth. You don't need much shilajit a day. It's like maybe my pinky, maybe not even that much, the pinky nail amount. It's so very concentrated, but it provides a lot of the amazing minerals that come from the earth. And it has been shown to bind up heavy metals, okay? But when you're doing that, you have to, if it's going to bind heavy metals, does it bind all metals? It's possible. And here's where I wonder, should we be taking shilajit and binding heavy metals, if that's what it does, okay? When it could also bind up our copper, and we need copper. Could it bind to magnesium, and we need magnesium? All of these things are really kind of metals that we don't think about. We think about electrolytes, or we think about minerals, but minerals are metals too. And if we take something, are we binding up the things that we need? I don't know. I don't know the answer. I'm just bringing that to the, yes, Shelley, I have heard that there are worms in salmon. Yep, I have heard it. Do we just, I know, it makes your eyeballs go, woo, really? Yeah, I don't know anymore. I guess, you know, Shelley, you just got to really cook it. You got to cook everything, okay? You can't eat sushi, and there's just, animals that, there's certain animals you can eat raw, and there's certain animals that you cannot. I'm coming, girl. That's Tootsie. Tootsie says, I gotta go to the bathroom. Yep, that's what she's saying. Hey, go lay down. Be a good girl, go lay down. All right, so I answered the question, Eddie, about shilajit. Hopefully you understood. Just go look it up. I mean, I was probably just giving a halfway answer. I don't know exactly. You're very welcome. I appreciate you too, Lara, for being here. It's, all right. So as a review, today we opened up with talking about the causes of heart attacks. Is it the lipid hypothesis? Is it the thrombogenic hypothesis? Is it a combination of both? I would say yes, okay? We talked about statins at great length. We talked about informed consent and knowing what medications do. Any medicine is changing a normal biologic process in our body, a normal physiologic process in our body. Thank you, 1910. That means a lot. When you guys send super stickers, super chats, it helps me keep this going. It helps the channel, okay? It helps me. I'm no longer working in the office, nor do I want to go back to working in the office. I can see 15 patients a day in the office. I can see 3,000 online or more. If I've got 21,000 followers, the chance of hitting 10,000 of them with this information is much more than I would have ever seen in 100 years of seeing patients in the office. You guys want to make changes, or else you would not sit here for 2 hours and listen to me. Thank you, Van. I appreciate that. Van just sent $19.99 as a super sticker, and I appreciate that. That means a lot. That means that it tells me that the information I'm providing resonated with you and got you thinking, and I do appreciate that. So as we continue with the review, we talked about statins, we talked about normal physiologic and biologic processes, we talked about informed consent, and you need to keep reading and listening, okay? You need to, you cannot just trust your doctor to give you every piece of information. You're gonna have to take some you're gonna have to take some initiative. That's all I can say, all right? I would also say that if you want me to evaluate your labs, evaluate your medications and your diagnoses, get a hold of me, ironladydoc@aol.com. It's in the description. You can contact me, just click and send me an email and say, hey, I want to do a consultation with you, okay? I think that would be a wonderful thing, even if it's just a one-time deal, just to get an idea of what your labs, because they're just calling you and saying everything looks normal, and maybe it's not. Maybe your stuff just isn't normal. Maybe there's needs to be more looked into, and I can help you decipher that. If the labs do look normal, I'm going to tell you they look normal, but usually I'm finding something that they never found or talked to you about it. You might not do anything about it, but you guys, it's worth knowing, just having the information in your back pocket in case you do want to do something about it, okay? So consultations, if your doctor will not order the labs that you think are pertinent for you, you can email me. I will order them for you. Does insurance pay for them? No. Can you turn it in as an HSA? Possibly. Your HSA health savings account might pay for your labs, but it might be worth it to spend an extra $300. I don't know what it costs. I mean, if you got my full panel, it could be like $350. Okay, and it's not my panel. It's just things that I suggest, okay? And I can send you a list of what I suggest, and then you can ask your doctor to get those things. If they won't, then you can come back and say, hey, he or she won't order these, can you? Yes, as long as you live in the United States and you don't live in several of the states that don't allow you to order your own labs. New York, New Jersey, places like that, okay? Rhode Island. Okay, so those are options for you. I am live every Saturday at 9 a.m. Central. I'm live every Sunday at 10 a.m. Central. You guys, if you're on Instagram or YouTube right now, check out my last reel. It went viral for me. It went viral, and the description of the reel is, why do you need a statin? Or do you need a statin? And then I want you to read the comments below, because you will see that how many people are still bamboozled. They're still so worried that LDL is the cause of their heart attacks. And they will not look at the infection rates, your sugars, insulin, smoking, alcohol, heavy metals, nanoplastics, lack of sun, LED lights, all of the things. I look up because I have these amber LED lights that I couldn't find regular amber lights. So I went with the next best thing. They're still LED. They're still causing problems with my internal well-being. And yes, I'm going to change them out. I'll probably, at this point, just go with halogens. Or, the original light bulbs, you can just buy them, that don't have any coatings on the bulbs. Yes, they get hot. They get very, very hot. Could they be a danger? Probably. I don't have my lights on all of the time. Okay. Sean, I do not do requests to be in live videos with the listeners. So, okay. So I guess we'll call it quits today, you guys. There's no further questions. Right. All right. So tomorrow, 10 a.m. Central, catch my last reel on Instagram, YouTube. It's on Facebook. It's on LinkedIn. It's on Rumble. I put them on everywhere. I just post it everywhere, okay? But it's why we need a statin. Or do you need a statin? Something like that. Read the comments. Read the comments. I replied to a lot of them, but read the comments. It's going to be good. And while you're there, like and share it and post it and repost it and save it. Save all that, okay? See you guys tomorrow, Lord willing. You guys have a blessed Saturday. Go blue. Go blue. All right. See you guys.